Good evening to you on this Easter Sunday. I'm Mia Gradney. A very different holiday this year because of the coronavirus. Now to three things you need to know tonight. Number one, Governor Abbott extended the state's disaster declaration by 30 days today. This is not connected to his stay-at-home executive order. This helps the state access national resources and also gives the state's attorney general the power to indict price gougers. Number two, the number of coronavirus cases in the Harris County Jail continues to rise. 16 more inmates tested positive for the virus today. And number three, many of you will receive your federal stimulus money from the IRS this week. The first recipients got theirs yesterday. But Marcelino Benito reports scammers are trying to take that money away from you.
If the IRS already has your bank information from your previous tax returns, you could start seeing those stimulus checks deposit right into your bank account this week. While you wait for the badly needed money, so are scammers.
Scammers are going to follow that and find it as an opportunity to take advantage of people. They're going to do that by making phone calls, by knocking on your door, by doing things through the mail.
Ryan Patrick, U.S. Attorney for the Southern District of Texas, says Houston is of particular concern. The DOJ designated Houston as an elder fraud hotspot. The pandemic brings scammers out even more.
There's just some scumbags out there that all they want to do is prey on people and use their resources to just steal people's money.
Scammers use the fact you're waiting on federal checks to gain access to your bank account. Here are three things to watch for. Number one, fake IRS calls.
No one from the federal government, no one from the state government is going to call someone and ask for personal information or banking information. And if you get those phone calls, just hang up.
Number two, look out for fake stimulus checks in the mail. If you're not set to receive your money via direct deposit, know that legitimate checks will take weeks to arrive, and they'll always be rounded out.
If those checks are weird dollar amounts, if they have cents at the end of them, there's probably some sort of number they want you to call to release the rest of that money, the money that you've heard the federal government will be sending potentially. These are all scams.
And number three, watch out for scam texts or emails. Scammers will send links in the emails asking you to provide information to get your money faster.
There's going to be these scam organizations that are going to reach out. Well, your check was only so big, but it can be this much bigger if you just give us this information. It's going to come in all different manners and means. And we want people to be very aware of this because it's coming.
Now, if you believe you got a call from someone trying to scam you by way of these stimulus checks, there is a number you can call. It's the National Disaster Fraud Hotline, the number 1-866-720-5721, or you can email them at the email address on your screen. Information like what number the scammer called you from and details of what script they used can be incredibly helpful in prosecuting them. And the U.S. Attorney says if anyone tries coming and knocking on your door and asking for personal information, you should call local police right away. We should mention that anyone that tries scamming folks during this disaster period is subject to even longer prison time. Mia, back to you.
Thanks for the heads up, Marcelino. Houston ISD begins another week of distance learning tomorrow, and they are trying to make it easier with a new hotline. They're also working to get more laptops for students to use at home. Jason Miles reports it's something many say is desperately needed.
I couldn't do my job from home without a laptop like this, but many students may be doing without while learning from home. Distance learning for an indeterminate amount of time is something for which no one was really prepared.
It has been interesting.
Some parents have relied on hard copies of lessons for their kids because of a digital divide at home.
Kids don't have computers, or if they have computers, they don't have internet. They don't know how to do things like uploading assignments and things like that. It's been a real struggle.
Houston Federation of Teachers Vice President Andy Dewey applauds a new HISD hotline going online this week, meant to help answer questions as students learn from home. Not to mention district efforts to get laptop computers into the hands of more students.
You know, we've joked about it in the past, but this is truly building the airplane mid-flight.
HISD says high school students have been issued laptops for years. And since the COVID-19 closure, special education students in lower grades have received priority status. Additional laptops have also been distributed to other middle and elementary school students, but more laptops are definitely needed.
Everyone is just trying to get adjusted to this new normal.
Interim Superintendent Grenita Lathan,
I encourage you to access HISD at home.
Recently told me the hastily developed system is not perfect. But learning continues at some level, no matter what. You can learn a lot more about HISD's new hotline on KHOU.com. Meanwhile, there are some nonprofits out there distributing laptops to students as well. Back to you.
All right, Jason Miles will pick it up from here. Thank you. Houston area hospitals are doing everything they can to help heal those infected. Tonight, Ron Trevino takes us to Katy to look at a special unit designed to handle the sickest of COVID-19 patients.
Houston Methodist Continuing Care Facility was originally set up for patients needing long-term care. It still does that, but also here now coronavirus patients. The hospital is home to what's called a highly infectious disease unit.
This was actually established a few years back when the Ebola crisis had started, in anticipation of any potential cases coming here.
Pulmonary and critical care physician Dr. Mir Ali Khan has been treating coronavirus patients. Houston Methodist shot this video of the other doctors and nurses who volunteered to work here to fight coronavirus on the front lines.
You know, we've got people from the medical center, from Sugar Land, from Willowbrook, from Woodlands, from all over, who are coming together for the common cause, for the common good of the community.
Medical staff members do what they can to protect themselves as they treat the patients. Patients ranging in age from their 20s to their 90s. The patients are in negative pressure rooms, meaning the air in the rooms goes through a filter before being released outside. Dr. Ali Khan says the fight is far from over.
Most of the epidemiologists in the Houston and in the Texas areas are still anticipating that there will still be a rise in cases over the next 1 to 2 weeks. So we're still trying to be as prepared as possible and make sure that we, have everything ready to go.
It is quite the operation. Ron Trevino, thank you. Researchers have mapped out big Texas cities where residents will most likely need high levels of care for COVID-19. One of the map's authors tells our Anastasia Bolton the goal is to help direct state and medical resources to the places that will need them most.
Surge capacity, hospital beds, PPEs, and ventilators all used to be words and terms many of us didn't know. But COVID-19 changed that. And with supplies scarce, state, federal, and local folks may need help with where to focus some of their attention.
It's better to have some data to inform the choices that are necessary for the allocation of resources than just to leave it to either comparisons with earlier outbreaks.
MAPS. Researchers at the University of Texas School of Public Health hope MAPS will help.
We thought if we looked at the patterns of chronic disease in different cities.
Scientists use the CDC and census data looking at cities like Austin, Dallas, San Antonio. The maps show where some of our most vulnerable live, those with heart, lung disease, diabetes.
I'm hoping that it can help inform the planning with regard to hospital capacity and also inform hospitals and nonprofit organizations who are tending to the social safety net.
Researchers are hoping state and local officials use their work to our advantage, saving as many lives as possible. I'm Anastasia Bolton.
Age, chronic medical conditions, and poverty all play a role in why someone could be more vulnerable to COVID-19. Researchers are now starting to analyze the top 20 cities in Texas based on their population. They will be able to look at the number of people who have risk factors and match them against the available beds and ICU units in particular counties. We have a way to send you personalized information about the coronavirus right to your phone. Just text any of the keywords you see there on your screen to 713-526-1111.